where are we going to do the best job and to have the less complication that are linked, most of all, with the technique going all around, walking around the different cities and the different countries. We find some problems that are usually linked to the indication, not to the product. Because when we are talking about the anatomy of the gluteal area, we are talking about this layer. Starting from the skin, we have the superficial fat, the superficial fascia, that is the scapula fascia, and the deep fat and the deep fascia, that is the muscular fascia. Our product needs to be set and need to be fit in the deep subcutaneous tissue. We are talking about the deep fat. If we are talking about volumizing or we are talking about reshaping the buttock, we need to be in the deep layer every time up to the muscular fascia. Why? Because we need, this is the anatomy that we have of the gluteal area and that everybody here in the audience knows and are used to. We are talking about deep tissues that we are not going to inject. If we are talking about muscle, we are talking about three muscles in the gluteal area that are the gluteus maximus, the gluteus medius, and the gluteus minimus. We have to be up to this muscle, above to this muscle with our injection. That makes the injection maybe easier, but not for this reason. We can do like without a good experience. And we are here just to explain this stuff for us. We are also talking about a quite safe place where to inject, because as you can see, all the major vessels are really deep down on the muscle. We are not going to inject inside, so it's really hard also to have a vascular occlusion or vascular complication like we can have for the face filler, and this is really, really important. Usually we are going to inject, to volumize and to lift this kind of triangle, but we are seeing the area injected later on. As I told you at the beginning, this is our injection there. That means all the green area, that is the fat tissue, the deep fat tissue, is the area where we are going to place the fillers. For any reason, we have to go down, or we have to go inside the muscle, because we can create only problem. We are creating it also if we are injecting the fat. And you know that the FDA and also the European Society are banning the intramuscular injection. So for the fat, and above all for the hyaluronic acid. This is really, really important, not to inject in the deepest area, the muscular area or the inner muscular area, because you could have only problem in the future. We need to shift between anatomy of the gluteal area in women and anatomy of the gluteal area in men, because also when we are going to inject, we have to consult the patient and to assess the injection in two different ways. That usually are these kind of ways. These are the aesthetic units that we could inject in a girl or in a woman, that are mostly the area that we mark with the 6, that is the complete gluteal area, avoiding to inject, as I will show you later, in the lower belly area. We are going to inject the upper lateral area, because when we are injecting in the upper area, we are taking and going to a lifting effect. If we are injecting in the upper lateral, we are going to shape all our curve of the gluteal area. But the last trend is also to inject in the lateral medium and lower area. That is what we call, or we see all around, like called the hip dip. As regards the men, we know that gluteal area are quite the same, but we know that the area to inject in this case are always subcutaneous. The entire gluteal area just to give the projection when we are injecting the man, and sometimes up to the trochanteric depression, not in the trochanteric depression, because in the trochanteric depression we risk to give just a woman effect. We feminize the gluteal area in the man, and it is the bad result that you can achieve. As soon as we have the screw, what is up on anatomy, we need to know how to inject. And above all, you have to really split between these four main topics. If we are talking about social media, I want to struggle a little bit this topic, because a lot of doctors, while we are, I or the other doctors of the committee do this kind of speeches or doing training, sometimes doctors are really confused on the final result that we get there, because looking on the social media, we see people with just one injection with amazing shape of the body. We have to stop with stop following this morphophobia that Snapchat, that Instagram, that Facebook put in our mind, because sometimes patients are pushing us a lot to reach that result that she or he saw on Instagram. Sometimes, you know, Instagram is based on filters. So we have to assess the real effective result that we can give to the patient. Don't be in a rush, as we see, as we saw on the video at the beginning, because we have to build our masterpiece. So maybe sometimes we need 2 or 3 steps to achieve the result that is a good result that could last for really that longer, because we are speaking and we are using a macromolecular HA. What does it mean? I will show you a little later. One other topic that is really important, and I'm here and talking with you in a national country, but also working in another country like the Middle East. When I'm in the Middle East, everybody is pushing me because the shape of the body of a woman like the one we see in the left side is completely different from the shape of the body of the woman in the right side. So when we assess the patient, we have to look who are in front of us and suggest the best result, because if we give the same button that the lady in the right side, we give to the lady on the left side, we give to the right side, we could create a monster, you know? Otherwise, if we do the contrary, the lady will be really upset, because she won't be such harmonic. And this is just to introduce the third topic, because the third topic is the sense of the artistic sense of beauty that everybody here, we are talking about aesthetics. So we have to be a little bit, you know, the aesthetic doctor, the aesthetic surgeon, what you want to call it, the same, is a sort of mix between an artist and a doctor. So we need to be really skilled, because we need to give them safety, we need to give them all the possibility to reach with our skills the best result, but we need also to look a little bit further as artists does. So what does it mean? Our artistic sense of beauty has to be based on 3 main topics. That is harmony, that is proportion, and that is symmetry. If we are talking about harmony, we are talking about the ratios that everybody in our body has. That is really the ratio between the breast, the waist, and the bottom. Usually this ratio is 1.6. It could change a little bit between the different countries, but with this ratio, if you are stable, like in a number, like an engineer, because also an artist sometimes is also an engineer, as you will have always a proportionate result that will give you also proportion and symmetry. Me as a surgeon, I'm doing a lot of breast reconstruction or breast implants to achieve an aesthetic improvement. And when I decide which is the implant I will use, I always look at the shoulder and I always look at the flanks. I always look at the body shape, because the breast could improve the symmetry and the proportion of the body. And as soon as I improve the proportion, I will feel better in looking to that girl, and the girl herself will feel much better also when she's dressing. That's the same with the bottom. Every time we inject and we want to achieve the result, we have to achieve the result always well balanced with the breast and with the shoulder. The last, but obviously not the least, is the skill that we have to have. We have to know really good all the different procedures where we can, what we can use for sure, and how we can achieve the result. That's why I introduced the three procedures that that are most commonly used to have a buttock enlargement. The first one is the buttock implants. We could have implants tailored or custom implants, but we all know that between all the surgery, maybe this is one of the surgery that needs the most surgical experience and the highest learning curve. This is really important because also super skilled surgeons sometimes are not putting implants because implants could have also a lot of complications if you are not so skilled. Also, if you are skilled, you could have this kind of complication. It's really important because that kind of infection, displacement, or extrusion is quite impossible with a hyaluronic acid. Obviously, we have to see, later we will see, there's some exclusion criteria also for HA, but in the end of all the audience, HA is possible. In the end of all the audience, implants is not that possible. Me too, I live in a country where implants are not so well tolerated. You know, if I live in South America, people are super happy if someone gives a compliment because I see the implant. If you say something to an Italian girl, she will be really upset. So you see how it changed the mind. The second one is the fatturare. For sure, maybe it's the most natural and safest technique. Also, the one of the most common that you can, the doctor could suggest you when you are looking for a buttock enlargement. And it has not such amazing or high learning curve, but it has a lot of several passages where you need stability, where you need maybe ANOR, because a lot of people is going to do this kind of stuff like an office procedure. But you know what is the result at the end? The result is really bad, because if you are not treating and cleaning the fat in the right way, the fat will resolve up to 80%. We can talk when you want. I use some, I always using new kit because I'm always in front of people complaining about the resorption, complaining that they pay a lot to have a surgery and not to have such an amazing result that are long-lasting. Because when we are injecting the fat, we all know that we are injecting micro cells. A lot of that cells, up to 50–60%, will die in the next 6 to 8 to 10 months, and maybe only the 30% of the stem cell will stimulate a fibrotic or a growth reaction. That means that maybe the result could be really poor, because you have to be also in a perfect diet, you have to not to stress too much the result with your lifestyle or with exercise, and you can go like to complication like this with scarring or infection. Now we introduce the fillers. Fillers background is not so easy because in the past 30 years, before someone like Dr. Vasquez intended to shift from the aesthetic injection of the face with hyaluronic acid to the body, that means changing the rheology of the molecule. That is really important if you want to have a long-lasting result. That's the biggest difference with the other hyaluronic acid in the market. We have a lot of hyaluronic acid for body. Not all of that. Maybe this is the only one that she marked approval. Why? Because this is the only one that has a molecule that is stable and stay longer without complication in the body. Because in the past 30 years, people believe that we can inject with something permanent, and we are talking about silicone, we are talking about PMMA, we are talking about also oil. But day by day and years by years, we found that all of these molecules are so aggressive that could have migration, infection, displacement, sometimes also big inflammation that I can show you here. It's really hard to solve. This is one of the amazing difference that we have. We are talking about macromolecules of the chain, but we are talking about a product that we can solve. Here is the silicone. We cannot do that. Here we cannot just go and in the right picture an extensive surgery to remove that bolus and that lump that migrate little by little inside the muscle. And believe me, I don't know how many of you are surgeons that is maybe a surgery that the 80% of the surgeons won't do that. Because it's really a problem also in the future, also in the post-operative time. Sometimes we are lucky because with this kind of permanent filler, we have just inflammation, so we can remove it just by pinching after a little cut with a needle, but sometimes we are not so lucky. So we have regulatory reaction, we have inflammation, we have infection, and we have to go sometimes in a hurry to an hospital to remove all the nodules and to have a bad scanning like this. And usually it's 2 or 3 steps. It's not just one operation. This is a case that we have with Dr. Kabai in Dubai, where you see she was injected with an oil. The oil gives a bad inflammation with a bad swelling and also a migration on the lower belly part. We have to remove it, we have to disinfect the treatment, and then we inject after 1 year and a half with the fat.
Wow.
So this is the biggest difference between the filler and the surgery. You could see how is high the learning curve, how you have to be an expert to use surgery for body enlargement, and how also as a beginner we can say you can keep in touch with the hyaluronic acid. One thing, because we are talking between doctors, we are not selling the product, we are talking between doctors, and I want that you come home with all the message that you really could have and could make you happier and safer if you start to inject with this kind of product, is that maybe the cost benefit could be the problem in the first consultation, because the patient could say, okay, this is a cheap, it will resolve really fast, and I will waste my money, and I will do over and over again. And this is not with the product we are using, because we are talking about macromolecules. Usually, this kind of molecules and this kind of treatment can stay stable up to more than 1 year and a half, up to 24 months. When we are talking about product, we are talking about non-surgical augmentation. So we need to know which is the product we use, and we spoke about it now. We need to know how much it lasts in the body, and we need to know also which is the to choose and which is the case to treat. And now I introduce this. The benefit of hyaluronic acid are completely this kind of benefit. This is a substance that we have in the human body. The scarring instead of the other surgeries that we could use, like the fat or the implants, are really minimal, and most of the side effects are maybe the swelling and the bruising. We don't need any sedation, so it's quite a safe office procedure. It's not that painful, and it's a repeatable procedure. This is really important, and I want to underline this this stuff, because the quantity could be adjusted for the patient, but the quantity should be adjusted. What does it mean? It doesn't mean that you don't need to have a wow effect just at the beginning. You need to build, and you need to also to share between 2 or 3, maybe 2, maybe 3 steps to achieve the final result, so you could avoid to have the complication that you could have if you inject 30 syringes per site just in one time. We are talking about hyaluronic acid, that we know that the hyaluronic acid gives inflammation as soon as it comes inside the tissue. So if we give too much, if we give a big amount, we give a big inflammation. So my suggestion is to share. Also, if you are not using 20 vials at the end, also if you are using 8 vials, you can share 4 and 4, or you can share 6 and 2 just to do the touch-up. It depends on your experience, and it depends above all on the body of the patient. Before I'm talking about macromolecules, this is the ratio, chemically speaking, why we are talking about macromolecules. This is a bit different in terms of molecules, is the resistance, and it's also the weight of the molecules. The different weight you could see here between a facial filler and the body filler. The body filler is a larger particle, so that means that it's more resistant to the aggression of the hyaluronidase enzyme due to the volume, but also due to the surface that the macromolecules have. That's why these kind of tools could last longer in the body. One question that you could tell me is, okay, you're talking about macromolecules, they stay longer, the products are, the volume is bigger, and also the particle is bigger, so it's really hard when I will inject this. The good thing of bioscience is that they develop, while they are doing the cross-linking process, this kind of technology. The isodromic technology is a technology that allows us to push easily the syringe that usually is a 10 cc syringe, and we are talking a syringe that we can also use for both ends. When we are doing the pressure, this kind of technology makes the gel easily flow inside the cannula, so you will not skip when you push. My suggestion is, if you have to use a lot of vials, use your palm, because sometimes the thumb could be really tired just after injecting 2 or 3 vials. But it's really easy to inject. If we organize in the next future, while we are talking before, trainings on live or trainings demo, you could easily understand this stuff. It's really easy because with this technology, the hyaluronic acid flow in the right way, like a facial filler, just a little bit thick when you are injecting, and we will be injecting with the right cannula. Don't think that we can inject with a 25G cannula hyaluronic acid like this, but also because we need a longer cannula. We need an 18G gauge cannula. 10 centimeter long is the best because you can reach between 2 points all the area that you need. As soon as the hyaluronic acid comes inside the tissue, the hyaluronic acid becomes one more time stable, the macromolecule rearrange, and the macromolecules in the day will be integrated in the tissue. This is a biphasic filler. That means also the isodromic technology is because we have a non-cross-linking chain that helps to enter and to flow easily. But the biphasic from a monophasic is just a chemical difference. It's not that big difference. But the most important thing for a biphasic filler is that it assures you a long duration, but you need to put it deep. It's really important. We are talking about body, I underline body, because a lot of the complications all around the world is because some doctor thinks to be really smart in injecting body filler in the face. And it's the worst idea that you can have, because you will have only bad reaction, you could have only big lumps, also really hard to dissolve. and sometimes you can create a lot of fibrotic tissue. So this is a body filler, like we stress the company to write on each box that is only for body use and use in the body. Maybe found a new way to use it. You can suggest to the company, you can do clinical trials, but we are talking about body. It's really important stuff. My experience is up more than 2,000 syringes, and I have just one big reaction with some complication, but the patient forgot to tell me that she was really injected with silicone, and therefore is that I got this that stuff. I don't have any chronic inflammation. One thing that I want to struggle also is if you have some lump, if you have some inflammation, use hyaluronidase. Don't try to use corticosteroid, don't try to use 5-fluorouracil, because all these products will make the patient scarring, and will give you bad problems. You have to use for sure hyaluronidase, maybe much more than you are using in the face, but little by little you will set the result. My experience also tell the stuff that I told at the beginning, that the result will resolve in 2 years, maybe resolve between the 30 or the 40%. Usually in my practice I injected after 2 years around the 30% of the syringes I inject the first time in the final result. And this is really the real data that I have. The lifestyle and the exercise could affect for sure the long-lasting effect. As doctor, our mission is to use the right product with the correct technique, and we are here for this with the right approach. And the right approach is knowing which is the area that we can inject. The area we can inject all these 4 areas, that is the complete flat case, that is the upper area, that is the lateral area, or the inner medial area. But in any case, we have to inject in the lower part. Also, if we are in front of wrinkles, because we are just increasing the weight of that part. So we are just worsening the result that we could achieve. If we are in front of the patient, the contraindication that means that it's not the patient to select for hyaluronic acid injection, is a severe skin acid, a poor tissue covering, and a ptosis of the lower third of the gluteal area. This is really important. The ptosis, how can we assess this? We can assess with a stretch test. If we are talking about skin laxity, we are going to, with a caliper, to measure a distance of 3 centimeters. We stretch the skin. If this distance is more than the 50% when we measure, that means that probably the iron is not indicated for the patient. It's the same that we do when we do the pinch test, always with the caliper. It's the same test if you are common with the breast implant that we use to decide if to put an implant up or down on the muscle. We need to have a fold more than 2 centimeters thick. If we have less centimeter thick, then probably the patient is not a good candidate for the injection. These are the processes that I'm underlining before. These are not a good candidate to achieve a good result, because we need really too many syringes to achieve a result that may give us more inflammation than a good result. So in this case, it's a case that you could treat if you are a surgeon with an implant, and then you can smooth the effect, because also in this case, implant could be really visible with the hyaluronic acid and with the expert hand that you need, because with an implant down the skin, you have to be really skilled to avoid to hit, not to go, just to hit, because just a little touch from a cannula that is not sharp, but it's blunt or what you want. The implant is really and to manage carefully when it is inside the tissue. So you could, for sure, shape a little bit some just to correct wrinkles or just to correct maybe a little bit of depression created by the implants. Also injecting the hyaluronic acid. The hyaluronic acid won't affect the result of the implant. These are two severe cases in which we cannot do nothing except of the surgery. And then I introduced the treatment protocol that is always to follow if you don't want to be in front of complication of the patient. After obtaining the consent, that is mandatory every time, we have to mark the area to inject. And obviously we have to mark the area in the standing up position. Never mark the area with the patient laying down on the bed. Otherwise, all our structure is moving, and sometimes, as it happens during the workshop, when I do the injection live, I used to mark before I inject, and I save the last syringe just to inject in the standing up position, because I can see if I'm doing the right thing, and I can correct if I need the final result. We have to clean really good, maybe 1, 2, or 3 times you can choose, but be really good in cleaning and in the disinfection, because it's really important, and this is the only risky point for the infection. We will give local anesthesia. Usually I use line opening of the Novivac with adrenaline in the entry point, and a little bit all around the area I'm going to treat. Someone you could see in another webinar or you could read somewhere used to give anesthesia like the client solution that we use for liposuction. In my opinion, it is not so used. It's quite useless because it's not a painful procedure. For sure, you could have the patient who suffer a little bit more, but you will have the most of the patients who say, yes, I can feel the cannula going around, but it's not painful. I want to do a comparison. If you are injecting with polylactic acid, both in the face or both in the body, polylactic acid, when you are injecting, but hyaluronic acid is not burning, both in the face and both in the body. So if you are using the right technique, hyaluronic acid, the 80% of the time don't have any, it is not a painful procedure. Sometimes if the patient has really a lot of pain, maybe you are in the wrong layer of the tissue, so come back and restart again. And we are using for MLF2 a cannula, a blunt cannula that is 18 gauge, 10 centimeters long. At the end, we will apply at the entry point some medication that could be like a strips or a band-aid. And really important and mandatory is the fixation. Okay? Is the fixation with adhesive bandages. This kind of fixation has to be in place at least for 3 days. When we do, I told you also that I try to avoid to use a large amount of anesthetics, because the large amount of anesthetic could change the shape of the area we have to inject. So maybe we could save some syringes thinking that we are doing a good job, but as soon as the swelling of the anesthesia go down, we have not a bad result, but then a patient that is not happy, and an happy patient that is the, I hope that you know that, is the worst thing that we can have in our office. One important thing is why using anything gauge. We can use also a 16 maybe. I started using 16 after 5 years, because 16 make the injection easier, but make also easier to have lumps if you are not so skilled, because you are it's too easy to inject, so you will have maybe lumps instead of a fanning retroclassic technique. That is the important, the only important factor while you are injecting. And if we are using a bigger cannula like a 14, you have to put the stitch, to put the suture. And you know, for an office procedure, it's not so comfortable, and the compliance of the patient could be really low in that case. Every time you will inject, you will have these effects. These are not complications. So I think that, and I hope you start doing this because it's really an amazing hyaluronic acid to use, an amazing tool to give to your patient. Also a new way, because sometimes you know patients are fixed on the face, but they don't see that maybe there's something in the body, and they doesn't know. Maybe they don't know that it exists and a shape that could give results in the body. Also, you in your communication has to be, and it happens also to me, because sometimes I'm one of the 5 of the board members. I work around the world for maybe 8 or 9 years, and sometimes my patient in English say, "Oh, you do body fillers," because sometimes I can do miscommunication. Okay, so communicate also in the right way, but I'm not the person to explain how to do. This is, I say, the effects that you have quite always in the first 5 to 7 days. That is bruising, that is swelling. The bruising is not like depend on the patient and above all of the technique. If you're going smart and if you're going soft, bruising is not so big. You could have a little bit of pain in the day after, but it's mostly because of the tunnel you create with the cannula, and sometimes the itching. The itching could be linked also to the adhesive bandage that we need to take for 3 to 5 days. These are some before and after. You see how we shape and how we lift with just 8 vials on the side of the first treatment and 2 vials on the touch-up after 1 month, 1 month and a half. One of the questions that you could tell us is how am I to wait to re-inject? There's no fixed day or fixed week. My suggestion is to wait like all the maybe hyaluronic acid a little bit more, because we are talking about macromolecules, from 3 to 4 weeks. The result will stabilize. After a month you will see maybe the result double, despite the result you see at the end of your procedure. And you will, in the first, the first time you are using it, you say, wow, it's a sort of magic. But you have the hyaluronic acid, you have to let the hyaluronic acid works. Inflammation, recall of the water, new tissue, new subcutaneous tissue, and better result. These are one more before and after. This is here, you could see from the slide, maybe from the light is not so well defined. Hyaluronic acid, like the face, has a moisturizing effect. Also the skin. Sometimes patients are complaining because they have, it's not cellulitis, but I got some little wrinkles. How can I do that? You do a body filler, and she said, no, I don't want a volume. And you say, we give a little bit of volume, but we give you also skin quality. We are talking about hyaluronic acid. We are talking about skin quality. Also in the body. Also if we have a thicker skin, we will have a moisturizing effect. Obviously, when we are injecting the end, the skin quality raise 100% more, but because we are talking about the skin that is really thin. But also in the bottom, you will see with the practice that the moisturizing effect is really visible. These are a case where I used to lift, and I want to share with you the image because you see how it's possible, and this is an instant result. It's better also after 1 month that I did it in a training, and she's a good-looking girl with also good curves, but she want to improve the lifting effect. Just with 3 syringes we add this effect. This is my nurse in my OR. She's like, she's really like Asian body, so because she's not so tall and not so big. And just with 4 vials, we achieved this result that after 2 years, I just improved with 1 vial and a half, so I used 3 vials shared in the 2 sides, and after 4 years, the result is still stable like this. All the world is pushing for the hip dip. This is an area of the buttock that now is really common to inject. At the beginning was a little bit discussed, but we can have with Hyacorp the possibility also to inject and to have this kind of result. You see how we inject. Look what a bad hip dip she has. And now what is the result? We can also mix injecting a little bit more superficial. This is an expert level for sure, but you can start doing it with MLF1 linked to the first injection of MLF2. But we are always talking about deep fat, so we can go with the MLF2 down just above the muscular fascia, and with the MLF1 just down to the scalpa fascia. That's why I'm talking about expert injection, because you need to be a little skilled. It doesn't mean that you need to have this iron cure. The more you do, the more you will be, and maybe the more you will tell to me some new tricks. Why not? We are here to share our experience. Asymmetric and traumatized body could be also perform a good enlargement and a good reshaping of the hip dip, also symmetrizing the other side with lifting and contouring. This could be also a good stuff. A good difference and a big difference between this and the fat is that if you're not reaching the result that you want, the patient could come to the office. We will do 1 vial more. We are not talking about we will change the implant, or we will do 1 more liposuction to do 1 more fat transfer. It's really easy, and it's really more comfortable also for the patient. And you can achieve also results like this. This, I'm not here to do the Instagram phenomenon. I do this stuff in 4 steps. I know as soon as she's a model, she's 1.80, and she said, I want to have a rounded gluten area, I don't like my buttock. And I said, okay, we can achieve a good result, but you have to be really calm, and you have to put your patient on the ground, because we need to have multiple steps to achieve the result that we achieve like this. If we compare this result with the polylactic acid, maybe we need 4 years with polylactic acid. I saw a lot of, and sometimes I really laugh when I look at my phone, because sometimes there are some colleagues that with just a simple injection of polylactic acid, we are, come on. We all know that it could be such a good product, but you need a really longer steps to achieve a result like this, that you could achieve it in 4 steps. That is not that less treatment, but it's maybe a good number, but you can achieve in 6 to 8 months. That is not so amazing time. Also because every step and every treatment, the patient will be happy, because she will see that she is improving. After the first step, she sees that she is better with the lifting effect. So when she wears some trousers or some pants, she can see the difference. Then we start shaping the curve, and so the frame of the buttock, and she starts seeing that if she improves a little bit more, she will be happier. So when she comes back to the office, she's really happy with the result, and she knows that you are giving much more with another treatment. This is really important. Now we are doctors, and we know that also if we work on the street, something could happen. So also with this treatment something could happen. But you don't have to be scared about the side effect. That is normal side effect that also a facial HA could have. So you have just, I know that Italy is really far, but we are now organizing next year a congress where we focus only on complication. Because now we talk maybe too much about molecules, about how to inject. We need to know how to manage complication, because complication is part of our work, I think, of every work. But if we know how to manage the complication, we could use in the right way the product, and we could give the patient the safety. Also, if something is not going in the right way, not for our fault. If we have this kind of problems, we can solve all of these with hyaluronidase. We need to be patiently injecting maybe a little bit more, but you could achieve a good result and re-inject after hyaluronidase with the same hyaluronic acid without any fear. Sometimes it could be a problem of the patient, because if the post-treatment indications are not followed by the patient in the right way, you say, so take the advantages. Sometimes they are complaining because they want to have the shower every day. Come on, for 3 days you could avoid to have the shower, just to have a good result that is a long-lasting result. You have to suggest to the patient to avoid to sit for a long time. In the first 48 hours, it's just to be also, if you are on a counter, if you want to do a laptop, you can move in and out for 5 minutes and then come back to sit. I suggest to wear a compressive garment like a post-light garment for 10 days. You can do whatever you want, also with this pants, so it's not that the compliance is good for the patient, but one of the most important things is to avoid gym and strength exercises at least between 10 and 15 days. This is really, really important. This is in case the patient is not doing the right job, but if the doctor is not doing the right job, it could happen this. This is a patient of mine, treated one side by me and one side by a doctor who is going to be with me in a hands-on training in my office. I told him to stay really deep. I told him to stay above the muscle and to look what he's doing. He's doing a lot of videos for Instagram to say that he's training in my clinic. And the problem is that this patient, after 4 months, has these nodules. Why the patient has these nodules? You see that. The right to the left side is the side injected by me. You see what is the hyaluronic acid, right? It's just above the muscle. Where is the nodule? The hyaluronic acid, where is it? It's above the scalp fascia. So, time by time, a little bit of migration, a little bit of superficialization of the hyaluronic acid, it's easy to create nodules. Okay? It's also easy to solve, because you reach the nodules really fast and really clear, also without the using of the scan, and you can solve this problem. But sometimes, and why I'm talking to put the hyaluronic acid down to the scalp fascia? Because the scalp fascia, it is just a wall that protects our hyaluronic acid to migrate upstairs. Okay? As a surgeon, I share and I change a little bit my mind while I'm using implants. If I can now, I put the implants under the muscular fascia instead of under the muscle, because I got the same coverage and the same benefits that the muscle could give to me, avoiding all the problems that the under muscle technique gives to the patient for the animation, for the problem of exercising, or for the problem of displacement if you are not doing the surgery in the right way. So that's means if we are there, we are not cutting the fascia, we are just pointing the fascia, because it's just a clip. So it's a clip that heals really fast, like a little hole that we do with a syringe. This is really important. Now I introduce you a video where Dr. Krapai is talking about just to show, because you don't have the possibility to see the live injection. So we decided to share this video where you could see before the assessment. Here Dr. Krapai is examining in the standing up position the patient, and then the injection technique. Here is showing how to manage this kind of patient by injecting in the upper area to give the lifting effect, and injecting in the lateral area to give the contouring effect. Now is marking in the standing up position the area to inject. You can also, this is, I think, in my opinion, the most important moment in the injection. You will get used to the injection after 3 or 4 treatments. If you are not used to do a good assessment, you won't be, you cannot achieve the result that you like to achieve. This is really important. Here he said that to have a good result, in the same time, you could feel both the upper part and both the lateral part. You will see that in this part is a sort of hip dip. We need to contour, but we need also to feel the hip dip. And sometimes it's not just a problem of a hip dip. You have to be skilled in understanding if you need also a lifting of the entire glute area, because remember, we are talking about symmetry and we are talking about harmony in the result. Okay, so we are not focused, okay, patient asked me for a hip dip, I will do a hip dip. Patient asked me and complain for that, as it happens for the face. If we are talking about, oh, I am the sagging, my skin is sagging on the lower third, we inject the lower third. No, we come up, upper posterior before, we lift and then we inject. So it's the same for the bottom. Anatomy speaks really easily. We have to give the lifting and then we have to give the contouring. Why always is like this? Here he marks the entry point, he decided to do 2 entry points. You could decide in the case of a dip of taking 1 more point just in the lateral part. You can see how is placing the lidocaine with the 30G needle. This is the only painful moment of the treatment. You make the skin blanches, so the ivory section helps you also to give a better way to make the hole. As you see, the hole was made by perpendicular incision. This is really important, because if you go perpendicular at the beginning, you go down to the scarpa fascia, you click just pressing a little bit, and you are in the deepest tissue. Then you could easily curve the cannula and reach all the areas that you want to be from that point. Why? Because the cannula is long 10 centimeters. So it doesn't need to inject that much. One more thing is, if you have to use more violence in an area, I suggest you not to go in and out every time you change the syringe, because every time you go in and every time you go out, and you go in, you risk to put the skin bacteria inside, and that's why sometimes you could have some infection or inflammation. You see how it is easy to inject. It really is injecting really easily, only pushing with the thumb. As I told you before, sometimes if you are not, I have a big hand, so for me it's easy. But also using the palm could be, because it's not a line, it's not a skin boosters, okay? So also if you push with the thumb, it's really easy to control it. I suggest you to start injecting and decide which is the best technique for it, okay? there's no one. But Dr. Maxwell's technique is not the best. It's my technique that I could suggest you, because in these 8 years I found it better. But if you change because your head is different or your mind is different, it doesn't mean that it's a bad thing. Okay? Just focus on what you want to do. You see, he changed the point of entrance. That means that he's creating a scaffold. Okay, it's such a sort of three-dimensional technique. If we do different time in different heights of the deep tissue, we are creating like a sponge. And you know that the harmonic acid acts like a sponge. So sponge on a sponge means that you could give a more volumizing effect. That means a better result for projection and for the contouring. You see he's injecting all the melted areas, cleaning every time you remove the cannula, and it's really important. This is one more painful passage when you massage. Sometimes patient could feel a little pain, and it's completely normal because you are injecting, and it's above all the trauma that goes with the cannula. But if you don't need to push to move that much. It's just to go in a soft massage, just to understand and to feel also where you place in the right way the product. The final shape, you give the final shape, and you start the medication with the stem strip, as I told you before. He's still now showing how it is. Look, to go in all around, just don't strangle the cannula if it's not moving, just remove a little bit, because sometimes the spider that stop you in your path. Find a new path and inject. The injection is, as you can see, funny, retrograde, linear, not boluses. Because this is macromolecules. If you do big boluses, yes, maybe you have the result, but after 6 months, you have just a big hole in your deep tissue that maybe if it could inflame more and it could react more, so it can create a nodule that we don't want. You see how he fixed the area with the bandages. It's just like a sort of taping it for the first 3 days to avoid not the movements, but to make an easier integration, because we are always talking about a deep injection, so we are moving, and the muscle, the gluteal maximus, is a little bit pushing the HA. That's why in 3 days, usually the hyaluronic acid is going to stabilize and you don't have any problem. You see how we fixed, and the patient will go to her house in this way. This is not, sometimes it could create a little bit of itching, as I told you before, but it's just because of the adhesive damage. Now we shift to the calves indication. We know that the calves is divided by a ratio of 1.6 between a lower part, where is mostly tendon, and the upper part, where is the belly of the muscle. We have to inject quite always in the upper part. Usually we have to create, when the calf is too thin, a little bit the convexity that calves used to have. And if we are injecting, we don't have to be scared about these vessels, because we are talking about the great saphenous vein that has big caliber and also big walls. So with the blunt cannula, if you are not pushing on injecting that up, it's really easy to hit and to go inside. It's really hard to go inside, excuse me. You don't have any principal other branches that you could eat or that could give you any problems. Also, in this case, we have to reject above the fascia. Obviously, the subcutaneous tissue is really thinner in comparison with the uterus. So you can say, okay, maybe it's harder to inject. It's not harder, you have to be, if you pull up the skin, you are quite above the fascia without any sort of problem or without being so expert in injecting. But what I want to tell you is that it's really different because the other only indication is the surgery. And the surgery in the country is much more, it's not that complicated like it could be the one